Welcome to Spotlight. I'm Sue Rakowski. In just a minute, we'll be talking to Dr. Akbar. Today's show is sponsored by Lake Huron Medical Center. Dr. Akbar, welcome to the show. You're relatively new to this area, although it sounds like you've lived a variety of places around actually the world. Tell me a little bit about you and your background.
Sure, yeah. Thank you very much for having me, first and foremost. New to Michigan within the last decade. I just finished my residency training over at Henry Ford in Wyandotte, and I'm happy to be in Michigan. Me and my wife love it here, and we don't want to leave.
Okay. So you've lived in a variety of places. You mentioned Kentucky and even overseas.
Yep, did my med school in Kentucky. I've lived in D.C., did my undergrad training there, lived in Florida. My parents live in Kuwait, which is in the Middle East. That's where I initially grew up.
Very nice.
Yeah.
So tell me about your specialties and what you do at Lake Huron Medical Center.
Sure, yeah. So I'm a general surgeon. I mostly operate in the belly, and I do all sorts of surgeries, whether it's minimally invasive surgeries, take care of things like if you're having issues with your gallbladder or if you're having any hernias, I'm the guy you'd come to see. I also do colon surgery, breast surgery for breast cancer. I do colonoscopies, EGDs, help patients with things like hemorrhoids, constipation, help patients with things like reflux disease if they're having any reflux symptoms. Kind of a wide variety of topics I like to discuss and manage. And if I can't figure it out for you, I'm happy to point you in the right direction.
Figure it out. You know, we hear that term minimally invasive surgery. What does that mean?
Great question, Sue. So minimally invasive is the kind of surgery where instead of having a large zipper incision, as they used to call it, down your belly, we can manage to do complex surgeries with very small incisions that are about the width of your finger.
My goodness. How does that work?
Yeah, so using a few small incisions, we go in, we inflate the belly using CO2, which is an inert gas that can get easily reabsorbed without a lot of side effects from the gas. And once we inflate the belly, it gives us more room to work with. And we go in with laparoscopic, which are a term used to describe the procedure, instruments. And we're able to do things like a minimally invasive gallbladder surgery or a hernia repair, where we repair defects in the abdomen, in the abdominal wall, or in the groin. And we often put a piece of mesh to protect it from bowel or other organs getting in and causing some serious potential harm.
No kidding.
Yeah.
We're going to be talking about a hernia event that's coming up, but how would I suspect it? What does a hernia feel like, or what are the symptoms?
Sure. So the symptoms can range in severity. It can be as mild as some discomfort, or you feel a bulge over your abdomen that can cause from a result of a prior surgery. If you had an incision, sometimes you can get an incisional hernia. But any sort of bulge that you feel, or if you feel some discomfort, or maybe like a hole in your belly wall, and you're not really sure what that is, come and see me, and we'll talk about it, and we'll take a look and see if that's what you have. If you do have a defect or a hernia in your abdominal wall, that increases your risk for things like bowel going in there and then getting stuck. If a piece of bowel gets in there and gets stuck and is not able to come back down, that's very dangerous. You could potentially lose the blood supply to that bowel, and it could potentially become what's called ischemic, and you can lose that part of your bowel, and essentially that part of the bowel dies.
Oh my goodness.
And you might have to have surgery to cut that piece of the bowel out. So it's always important to talk to your surgeon and to try to get hernia surgery fixed electively as opposed to emergently when it becomes dangerous.
Serious situation. Well, let's talk about, there's an event coming up on Wednesday, November 13th from 6 to 7:30, I assume at Lake Huron Medical Center.
It is, yes.
Tell me about this event.
Yeah, so this is an educational seminar where the goal is to try to ease patients' concerns about hernias, discuss how that we do the surgeries, discuss what the options are. I personally like to do my hernias robotically, which is a subset of minimally invasive surgery. So with robotic surgery, I'm the one that's completely in control of the robot. Nobody's doing the surgery for me. But the robot helps me get certain maneuvers and certain articulations that I couldn't do without the robot. And so it provides me some extra flexibility. Really, these remarkable advancements in technology are just helping me do my job easier, which ultimately means that the patient's getting a better repair. And so this event is kind of promoting the different techniques we have and educating patients about the ways that we can improve their lives and see whether or not their bulges are they hernias, or is it something completely different, which I may also be able to help them with, but it's kind of like an educational kind of event.
And it looks like we need to, registration is required, so just call Lake Huron Medical Center and
Yeah.
sign up. And
Absolutely.
again, November 13th from 6 to 7:30.
Yep. And I just want to stress, at the event, you will be getting education, but you will not be getting treatment for your hernia.
Sure.
This is just to kind of give you some information, and then from there, we can go on to having a clinical discussion in a private setting where you, as an individual, will be treated and have more things explained to you.
All right. Well, thank you so much for joining us
Pleasure.
today.
Absolutely. Thank you, Sue.
And thank you for watching this edition of Spotlight.